Happening now, thousands of nurses and healthcare professionals at Kaiser Permanente are officially on strike in Oregon and Southwest Washington.
Fox News' Mackenzie Richmond joins us live from the picket lines right now. Mackenzie, good morning. Tell us what you're seeing.
Good morning. We're here at the Kaiser Permanente Sunnyside Road Medical Facility here, where you can see just moments ago, picket lines are officially up. You can see all of those signs. Just where we're standing right here, there are dozens of healthcare workers. But really, moments ago, there were hundreds standing with us. Many of them actually went up to the front of the hospital doors, waiting for the night shift staff to actually be released right at 7. And they're welcoming them out to the picket lines, out here to the strike, as they all head out of their overnight shift. Now, this, as I mentioned, is one of the 6 locations where about 4,000 healthcare workers, nurses, lab techs, physical therapists, and more are now striking. And this after months of stalled contract negotiations with Kaiser Permanente. Union leaders say the walkout was their last resort, but nothing was being done to address their demands regarding not only pay, but also staffing shortages, burnout, and lack of input in patient care decisions. Now, Kaiser Permanente is calling the strike, quote, unnecessary and disruptive, noting it's already offered a 21.5% raise over 4 years, along with strong benefits. They also say the union's demand for 25% raise is unrealistic and would drive up costs for patients. Now, Kaiser has activated a strike contingency plan, which includes thousands of temporary staff, virtual care options, and potential rescheduling of some non-urgent appointments and procedures over the next 5 days of the strike. Now, I do want to mention that just moments ago, actually, I spoke with the head of the registered nurse department here at this Kaiser Permanente location, and she said, while they do have good pay compared to certain areas, such as the more rural Eastern Oregon portions, in areas that are actually equivalent to the same population as Portland, they are severely underpaid and severely understaffed. So we're getting a little bit more context here now at the picket lines. And of course, we'll continue to talk with people here all throughout the morning. But seriously, a crazy turnout here. Dozens of people, really hundreds once they actually come out. But one more look at all of the signs here. You can really see this one right here, really powerful. You can't put patients first when you put staff last. And that is something that we have heard from several people here, all of these healthcare workers at this picket line right now. For now, reporting live, Mackenzie Richmond for Good Day Oregon.
All right, Mackenzie, thank you very much.